Welcome to the Preventing Distressing Behaviors in People with Dementia training for first responders, presented by Idaho Commission on Aging and Idaho's Community Care Program. Common Dementia Challenges, Module 1. This training is meant to meet the following objectives: to teach you about the basics of cognitive dementia, to address the common dementia challenges, to address how to mitigate and prevent the behaviors when performing an emergency intervention. In order to demonstrate these concepts, we'll have assistance from Don and Todd, two Idaho-based members of emergency medical service teams. They will help us by demonstrating the techniques for working in a care team of first responders who may encounter patients who exhibit symptoms of dementia.
Hi, I'm Todd.
And I'm Dawn.
And we are paramedics representing emergency medical service workers here in the state of Idaho.
When you arrive on the scene of a call and learn that the patient you're treating may have dementia, this training contains techniques that may help you adapt your approach.
While you may not always be certain of a patient's diagnosis, when in doubt, consider using the techniques in this training. They may be helpful in minimizing distress for a variety of cognitive issues.
Each video will demonstrate a core concept, and in the final video, we'll play the scenes out in full so you can see us reenact a positive intervention for a patient with dementia.
But first, we'll start with identifying common dementia challenges. Everyone is unique. Every person you meet is unique. They have different bodies and levels of health, different personalities and levels of education. They have gender, ethnic, and cultural influences and have lived through different experiences. Every person you meet with dementia is similarly unique for the same reasons. In addition, they may have different types of dementia or be in a different stage of the disease. However, there are some things that people with dementia have in common. Brain changes. As people age, they lose neurons, the special cells that power the brain. But people with dementia lose their neurons in a very specific part of their brain. It's the part of the brain that helps us plan, use good judgment, and make wise decisions, mostly in the frontal lobe. Because people with dementia lose this part of their brain function, they have problems planning, understanding cause and effect, thinking logically, and making appropriate decisions. Their brain is also more sensitive to things like overly busy or confusing environments, and abrupt changes to their environments, caregivers, or routines. Language and memory loss. As the disease progresses, people with dementia have problems using words to communicate. They also lose neurons in the hippocampus, which makes it hard to remember things, especially what has happened recently. Many times, long-term memories may remain intact, while things that happened minutes ago become hard to retain. Survival and emotions. The part of the brain that works the best in people with dementia is the amygdala, located deep in the brain. It is the amygdala's job to help us all survive. It is the first part we use as babies, and it stays with us all of our life. It's also the part of our brain that assists in social cognition, interpreting cues like facial expressions and body language. People with dementia use this part of their brain to watch for things that could hurt them. It especially notices other people's body language and emotions to decide if the person is a friend or a threat. What it all means. Because of the changes in their brains, people with dementia may not recognize or remember where they are or the people around them. They may not be tracking all the details of what is happening in their environment. This leads to confusion and can cause worry, anxiety, and fear. Here's a few examples of things that can cause distress or exacerbate symptoms in a patient with dementia. Sudden or loud noises, being touched unexpectedly or without warning, unfamiliar people or new caregivers, changes in environment or routine, moving from one location to another, overly busy or confusing environments with bright or harsh lighting or noise, lack of clear communication or not understanding what is happening, being rushed or having things done to them without explanation, physical discomfort or pain, injury, hunger, needing to go to the bathroom, feeling unsafe or threatened, unmet emotional needs, including loneliness, fear, and frustration. Next, we'll talk about what stress responses look like in people with dementia.